Today on the podcast, I'm thrilled to welcome Philippe Gerwill, a global thought leader in digital health, innovation, and the future of healthcare. Philippe defines himself as both a humanist and a futurist, always seeking ways to blend cutting-edge technology with a deep respect for human values. With a background spanning executive roles in pharma, advisory positions with leading medtech accelerators, and a passion for emerging technologies like AI and the metaverse, Philippe has dedicated his career to inspiring better healthcare worldwide. He's served as a mentor, board advisor, and innovation advocate across Europe, the Middle East, and beyond, helping startups, organizations, and professionals navigate rapid change. Philippe's unique perspective bridges business, technology, and human-centered care, making him a sought-after speaker and influencer in the global health ecosystem. Get ready for a fascinating conversation.
Hi, good morning, Phil.
Good morning. How are you?
Not bad. It's my pleasure to having you. Every guest I have, they have a very tight schedule, but none of them like you. You're extremely busy. You keep traveling, and I tried my best to have you in our first season. But now, luckily, you are with us today for the second season. So it is my pleasure having you and learn from your experience and also the diverse background you have and different marketplace you have worked for them. So Phil, would you like to give us a brief about who you are?
Okay, so first of all, thank you for the invitation. Sorry that you had so much trouble to get me on, but it's my pleasure to be here. So my name is Philippe Gerwill. I'm living in France at the border with Germany and Switzerland. I spent about 30 years in the industry, about half of them, 15 years in specialty chemicals and 15 years in pharmaceutical and biopharmaceutical. And I'm on early retirement since September 2022 from the pharma industry. And I started already before, and then I moved more into healthcare, becoming an international speaker, an advisor, board member, a coach, a mentor. So I'm trying to, give back to the community and trying to help, all the people out there as much as I can.
Absolutely. And anyone it's following you in the LinkedIn, they can realize that. And one of the things when I start to prepare for this podcast, it was very hard for me. When I went for your LinkedIn, I tried to study it. It's very hard to study it. It is a curriculum. You have more 64 role in your LinkedIn.
I think it's more than 65, but of course some of them have stopped and some not. But I still have probably more than half of them are still active roles. Again, very different. Some being advisor, some being board member, some being ambassador, brand ambassador, influencer. So it's a lot. But on the other side, for me, the combination. They are all very different. And it gives me, a broader view of the industry and all around.
This episode, I find it's too hot from the beginning. So how you find a time for that? Because our generation, still you are young, but our generation, we keep saying, I don't have time, I don't have power. It is too hard for me. So someone like you that have that energy and excitement all the time, from where you find those energy and time?
As I said, that the energy for me is kind of a mission first, giving back to the community, to the younger generation. So I'm really motivated about that. I said, some people may understand it differently when you say, you're in retirement. Even my wife understood it differently. She was thinking I'm going probably to sit on the terrace and having some drinks every day. Actually, I'm more busy than before. But I love what I'm doing, and I'm very happy every morning I wake up. I enjoy what I'm doing, and that gives me, first of all, a lot of energy. If you love what you do, I think there's barely nothing during the day where I do something I don't like to do. And the second thing is, and we might already start in some of my special topics, since more than 2 years, AI is helping me a lot. So, AI is indeed increasing my productivity, being with emails, being with some work preparation and all that kind of stuff, So AI is indeed helping me to do more, removing me some of non-added value tasks and stuff like that.
Absolutely. And it's good to see you see the value of the AI, and it is working for us and helping for our future, is not against ourselves, especially in the healthcare. And we will touch base with this. So one of the things, Phil, you define yourself as health futurist. So what is your definition by your terminology for futurist?
Yeah, so before that, you missed the piece before. I also define myself as a digitalization humanist. which means that basically I'm a big fan of all the technology, the new technology, but, they should serve the human and not the other way around. So I said, I use the technology, but I want the technology to help us even to become more human because we are losing that. Now, from a futurist point of view, I think, I'm don't ask me where it's coming from, but it seems that I see the trends much before, and I'm lucky, to give directions to people what the future may hold. Having been on technical side, I took the blockchain, for example, years ago, when people said it's just a hype and whatever. And when I took blockchain, I mainly talk about cryptography, not cryptocurrency. Also, it's there, but my focus was on cryptography. A lot of other things, I said AI, metaverse is another one where people may still doubt today, about the real use of the metaverse, but it will come, although people thought, it was a hype in disappearing. Sometimes I'm even happy when the focus is disappearing from some big companies like Meta themselves, and all that, because I think I want topics like metaverse not to be linked to one brand. Like Meta try to do that, but I'm okay. If Meta wants to do metaverse or not, it's not my problem. There are many other companies also, So for me, the metaverse is more having all this immersive experience, so that people can also better learn and all that in a different environment. So for me, where it's coming from, the futurist, is just that it seems that what I'm saying is coming, it's happening. So I might be lucky on that side, and I cannot explain where it's coming from. It's some connection, something in my brain, which helps me to make maybe unusual connections compared to other people.
So is this is something, a skill set you gain from your experience to start or to be able to predict or forecast what is going on and connect the dots together? Or this is something anyone can do it? It's not require that extensive experience or knowledge to do that.
Yeah, and unfortunately, I would love, the second one, but I don't think it works like that. And even when I was in corporate, sometimes some people in my organization ask me if I can help them to get those skills as well. And I would love to, but it seems these are some connections in my brain from experience, whatever, that, sometimes when I was on some big programs, and there was a question, I gave the answer like that, and then people say, but they were thinking themselves, but how can you give the answer like that, without doing some more research or whatever? And afterwards, they always figured out that I was right. But why I was right, they asked me, can you teach us that? And I said, I would love to, but I don't know. It's something, some wire in my brain that might work differently, So I would really love to give, those skills to other people, but it seems that it's not so easy, something inside my brain.
So speaking of the corporate, if the corporate, assuming have that culture of innovative and supportive and collaboration, why some people they find this a good opportunity like yourself to build the skill sets and build this in your brain, and the other they don't have, and they try other to support them and do the work on them. So from your experience in very positive way, what is the motivative for some people like you with having this culture help them to do what they like and the other they not?
I think, sorry to say that, but first I think, the employer and the corporation and all that is already an issue, because you're not free. I'm free. I'm on my own. I can say what I think, If I say something crazy, it's my problem, I don't have to report to anybody. So usually that's the point. That's why I get a lot of invitation and people still ask me, to talk, because I say something different. I don't say the same as everybody is saying. So I bring a different view. I give you an example. Just last week in Dubai, I was on a panel about women in healthcare. And I was the only man on that panel, so of course I'm supporting a lot of women, but again, we need to be there. And my comment was, for example, at the end, I got the closing comment. I said that it's not about the women to get a seat at the table for the women. It's about changing the table. So I bring a different view because I just go further, I go further because again, the problem we have today in many areas, we are not going to solve if we use the same thinking as we used to create them. So we need a different approach. And we are still looking too often just about iterations, some small changes. If you want, to disrupt, you have to be more radical and really come with completely different ideas.
Absolutely right, and totally support this. So sorry. So I've been in a big corporate, and I totally reflect what you have said. And sometimes you cannot go with your opinion or go with your principle if this is against with the corporate culture or vision. So one of the things here you touch base on it, and I would like to get more deep. Why till now, after a long time of investment from private sectors and from the public sector and all those innovation, is still some of crystal clear issue in the healthcare? We are not solving the root. We are solving the sign. Is we are not trying at all to get into the root. You bring something, the customer bring it. We need to change that whole table. Why not we try to change the system and we keep the old outdated system and try to invent it with a new technology?
So I think it's a very, very, very good question, and I think it's the heart of the challenge we have today, because whatever we say, the whole healthcare is on fire. We are running into the wall. We all know that the population is becoming older, that we have less and less workforce in healthcare, and and despite just the aging and the generation gap, there's even a bigger issue, that in most of the countries, including the US, UK, some countries in Europe, and I think probably even more, 30% of the medical students are not going to start as a doctor. So the gap is becoming even bigger, because for the moment we count these students as becoming doctors, 30% of them we are going to lose. Because, of two key reasons. One is being bureaucracy. You don't learn to be a doctor to fill papers and entering data in front of your screen. A doctor is aimed to do something different. Again, coming back to my human point, And the second one is being the work-life balance. The younger generation is not ready to do all this shift work, long hours over the weekend when you work in a hospital or whatever. So I think 30% is even increasing the gap we are already aware of. So again, the house is burning. And again, actually, we should, again, not talk solutions. We should talk changing the approach, changing the systems. But the system is so powerful, and to disrupt this system, with different players, being the pharma, being insurance, being government, being doctors, whatever, it's not easy to change that. Because, for some of them, they have a system that is working. And it's nothing wrong to say, having worked in pharma, and again, I learned a lot in pharma too. But, pharma, actually, we are doing more sick care than health care. We need sick people so that those companies make revenue. Same, and all this. So the actual ecosystem is very strong, built on a certain model. And changing this model is difficult, because of that. Take an example, we will talk a lot about preventative care, wellness, fitness, and all that. Everybody knows we should go there. The patient knows they should get there. Doctors may also help there, because on the other side, they still need to have patient in the room, to get revenue. So it's not that clear where are the driving forces for that. So preventative care, what is for the moment the benefit of a pharma company to do prevention rather than to sell pills or treatments? That's not their business. They have nothing to sell in the preventative care. Doctor might, because the doctor might still have a visit to tell you to keep healthy and what you should do, maybe without medicine. But for the pharma, for example, there is no interest there. Insurance might have an interest, but are they really going to fully adopt that? I give you an example. 2 years ago, I was invited in Davos in a closed door forum about preventing wars. And my comment there was, there's a huge budget for wars. And basically, it's not just defense, it's defense, reconstruction, and everything. So it's probably one of the biggest industry in the world. Why is the budget for peace? And I have the same challenge with sick care and preventative care. Who is going to pay, for example, a $5,000 cancer test to a young 20 years old guy with no symptom? And we all know, gut feeling that at the end of the road, there will be a saving. But who is going to put the money today to pay this test when you think it's not necessary because there are no symptoms? So I really think, the whole system is sick. And unfortunately, changing the system is more difficult than starting from scratch. And where can you start from scratch? There is barely no place. I have a big hope, for example, with the project NEOM in Saudi. NEOM, for the people who know, it's a huge project, building this whole line city and even some other cities, which is basically building from scratch. So for the moment, the message is that they will concentrate on wellness and preventative care. So from scratch, you could build a different system. But where it's not from scratch, in a legacy environment, it's difficult to change, to shuffle this system, knowing also that there are very powerful players around the table.
Wonderful, lovely, lovely. So, what you say about that rumor they were mentioned? Our healthcare system worldwide, globally, is it's managed and owned by a big pharma company.
Not only, I don't want to blame only the pharma, it's the pharma, but there's also government, there's insurance, there are many, even the doctors, the doctors are different from, there's also doctor lobby, in some country, which is different from the others. And we have seen that, for example, during COVID, why it was not handled the same way in different countries, because, of course, we ask the doctors, but all the doctors don't have the same view. So doctors are also powerful in terms as a group. I think it's the power of the group. It's not the individual, but they are the big group. Insurance is the same. We all make the assumption that insurance might be the one that could help us to change that, because, insurance might have a benefit if we pay less in treatments and drugs, but maybe not. Do you think that pharma and insurance are not talking together? The lobby is only going towards politics. So I'm just saying, there's a lot that we don't know in these driving forces between that whole ecosystem.
And this is crystal clear for anyone normal person to understand. This is maybe financially driven, and all those big corporate, they are looking for more revenue and profit. That's fine. But when it's coming from technology and you adopt that concept of digitalization, humanist, why we bring solution, it is not human centric or patient centric?
I think that's not always the issue. I think some of them, are patient and human centric. I think the challenge is more the adoption. I've also spent a lot of years, in IT and technology, and quite often you have to make you aware again that you're talking to people that might not be technology guy. So we have a tendency to not understand each other, from a technology and simple user point of view. So we have to be clear, that users, that you also speak the language of the users and the business, and not just the language of IT. And I think that's very important. Patient, I'm not saying it's not patient-centric, but of course we have to design it with the patient in view. Everybody say the patient in the middle, but I agree with you, it's not always, it's more often words than the reality. And patient in the middle means also we have to speak a language that we can understand. And today I'm saying tools like AI, and being ChatGPT, DeepSeek, whatever, can help you there, because you can, for example, I do it sometimes, I have the example of my mother-in-law who is more than 80 years old. And when she's getting a report, from the lab and from the doctor, that's kind of Chinese for her. So I can ask ChatGPT, translate this into a language that the 80 years old person can understand. Same for younger people, 12 years old, whatever. So today we have this opportunity to have that, because, a doctor is talking his language, he's telling you terms that you don't understand, you never heard before. And then you say, yes, but you have not understood that. So the point is also to get, to speak the language of the patient.
Absolutely. And for the communication, what's coming from the healthcare provider, from your perspective, do you think still also as a human to human, we are not seeing the patient centric and we are not humanized when our communication, and we driven because we are busy and overwhelmed? And this is something also we need to consider along with the technology.
Yes, I think so. And again, of course, I don't like, the conflict that we are entertaining between AI and doctors, saying AI is better than doctors or doctor is better than AI. And this is not helping the whole environment. But the reality is, you probably heard, early on there were some tests, where people even found that AI is more empathetic than doctor. And again, there's nothing wrong in that. AI is a machine, like a robot that is not getting tired because, that it doesn't know what is tired and it can just work on, on and on. We are humans, and that's also, I think, one of the nice things of the difference being human. But, we get tired, we have moods, we have good days, bad days and all that. So of course, same for a doctor, especially if he's overloaded, he might not be that empathetic, with the patient. And even I have a nice experience last year During summer, I had an interview with O Globo, which is the biggest newspaper in Brazil. And they got out, the title they took out of my interview was "Doctors are becoming robots and AI can liberate them," which is the opposite of what a lot of people think. But that's the point I'm saying. Today, a GP is a robot. In my country, a GP is close to, sorry to make the comparison, to the American border, to the immigration. It's kind of next. We are losing the human touch. That the average visit of a GP is 10 minutes in most of the countries here around. And out of these 10 minutes, 70% is in front of the screen and entering data. Only 30% is with the patient. And I want the technology to help to reduce this 70% so that the doctor becomes more human. If an AI can write the report, and of course, with supervision of the doctor, but 80%, 90% of the report can be written by an AI, and then the doctor just review it and tick it and goes on. If all the blood test analysis, X-ray can be pre-screened for the doctor when the patient is coming, because the patients think the doctor has, if he's doing a blood test 1 or 2 days before, I think the doctor has seen the blood test. When he's coming, he starts to talk. The doctor opens the blood test at the moment you come into his office. He has no time to do that before. No time and no memory or whatever you want to say. We are humans. So I'm saying, technology could help us to become more human and not the opposite.
Yeah, and you remind me with a story. It's happened with me with a surgeon here in Canada, and I was working on health tech solution to implement it in their hospital. He told me he spent more time in documenting what has done in the surgery more than the surgery itself. So he spent time on the documentation more than in the surgery itself. And he felt very sorry. He thought, I need to stay with the patient, educate the patient, assure the patient, more than spending the time. And that time he blaming me and the system, why it's complicated. So I can understand that and I hear you. So do you think inject a clinical team and a clinical background team working with the health tech company, is this some luxury or mandatory?
I think it's definitively mandatory. And to jump on what you said, again, I talk a lot about my own experience. It's not just something I have read somewhere, So I experienced that, I had a surgery last year, where basically while the guy was doing the surgery, he got some more phone calls and all that, and so basically those guys, they go from one surgery to the other. And in the evening, they do what we call the pajama time, where basically they spend 2 hours to report all what they have done during the day. Most often just on memory, or maybe if they're lucky, they have recorded it, But again, it's an admin work that could be done differently, I would even not say by somebody else. It could be somebody else, but it should even from today, from my point of view, be done with the help of AI so that even somebody else would not be under that pressure, because it's also difficult for a person to write something for somebody else who didn't attend it and things like that, So I'm saying, there is a lot of need there. Then the second point, which maybe is behind your question too, is, delegate also some tasks to other people in the healthcare system, being nurses. Even I talk a lot, at least once a year and sometimes more, also at the World Pharmacy Congress. Pharmacists also could do more in that system. But again, we have first to fix the same, because when I talk to pharmacists, don't forget, that the community pharmacist is probably the person that sees the patient the most, because you go more to the pharmacy than to the doctors or to the specialist. So they have a lot of information, even in the system, in terms of your consumption of drugs and all that. Now, the issue is they could give you much more advice if they would also have access, for example, to the medical record, even to the report of the doctor. But the doctor is not sharing the report with the pharmacist. But again, first we should also remove some admin tasks from the pharmacist. Things should be automated and all that, so that the pharmacist has the time to talk to the patient. When I go to the pharmacist, quite often there's a queue. And people would not like if you spend too much time talking to the pharmacist because the next one is already waiting in the back. So we have always the similar issues, even in different professions, in healthcare. But we have first to get rid of these non-added value tasks so they can do what they could do better. Because a pharmacist should not just be a dispenser. A pharmacist is also studying medicine. He also has more knowledge than just being a cashier like in a supermarket. But again, we have to free up that time to give them the opportunity to do that. Now I tell you also, some doctors are not open to give more to the pharmacist. Also, they may be overloaded. They say doctor is doctor and pharmacist is pharmacist. During COVID, we were happy to have the pharmacists jumping in and doing a lot of vaccination directly in the pharmacy, that you didn't have to go to the doctor. But you know that in some country, once COVID was gone, they went back. They cannot do it. You have to go back to the doctor now to get the vaccination. So again, there is still a kind of people, from my point of view, people that are overloaded are still not open to give some of their responsibility to somebody else.
Yeah, and thank you to bring this on the table, and this is make it crystal clear for everyone how it is sometimes the system and digitalization to be a humanist. And the example where you shared about the pharmacist, it's reflecting on my experience. I have similar experience here in Canada. In Canada, to overcome the challenge of having less family doctor, here they give more power for the pharmacist, so they can look after for the patient for specific diagnosis and symptoms, and they can prescribe the medication from their side. I went for the pharmacy for infection in my eye, and they spend more time with me better than the family doctor, and try to help to take the history and to understand the symptoms of this infection to give me the right antibiotic. But what happened? As you mentioned, they don't have access to full my record, and they spend more time than I have it into the family doctor. So in the family doctor, just assumption is double the time which I have it in the family doctor. So for me, no, it's better for me to go for family doctor and spend time there, because it's longer. So what happened here, when they try to fix an issue, they try to fix it, but they are not fixing. They create other problem. And here you can see, as you mentioned, also some of doctors, they are not cooperative to do that, because it's still politics. They want to make sure they have control and upper hand on everything. Whereas something is very bad, because we need to think about how we can serve the patient. Our patient, it is our customer, our client, how we can serve them the best and make sure they take the right treatment and right service. But this approach is not in health.
And the issue is, as we started the discussion, the house is burning, and it's not becoming better, because we're becoming worse and worse because of the challenges that you have. So I give you another example. More and more we talk about holistic health, we talk about wellness, we talk about even nutrition, everything coming together, because at the end, in genomics, we know that all these things has an impact. We are all different, as an individual. You know that even 40% of the drugs are not working on you or me, and we still continue to prescribe, because there's nothing else. But the issue is, why I'm saying is, you go even in the wrong direction. In many countries, and I know at least UK, I know France, or Germany, if you go to a visit to a GP, as I said, it's 10 minutes. But if you come, for example, for an unplanned visit, it's not your regular standard visit, whatever, you have an issue, it's 10 minutes for one symptom.
Yeah.
My wife had to go through that. She had some pain in the chest, and then she said, I also have headaches. And they say, no, it's 10 minutes, one symptom. And then we talk about holistic view. We know that the headache and the chest and whatever are connected. So how can you treat the patient in such silos, saying 10 minutes, this time we talk only about your chest. If you want to talk about your headache, you have to come back, in 2 days. So as I said, we go completely in the opposite direction of what we know about healthcare and where we should go.
Absolutely right. We have the same concept here.
Bigger, the issue is becoming even bigger.
Yeah, we have the same concept here. One symptoms per visit, not per 10 minutes, per visit. And I cannot imagine. I have those symptoms. How I can share one symptoms? It is your doctor. You need to make sure, are those connected or not? I am one body. I came for you. So I don't understand how it's going. And yeah, absolutely right. This is how we see it from our end. So from your experience, or from those 30 years, and you are heavy traveler and engaged with different healthcare system worldwide, is there any good story to tell? There's improvement and humanist, and we become more close with the patient. Any initiative worldwide or any success you have witnessed?
First of all, I said, I'm blessed to be able, to travel in so many countries. And again, it's always very interesting for me to see the differences, to meet different people, different culture and all that, because I think that's, really what is the richness of our world. So rather than seeing, the fights and the wars, we should see that we are all different, and that makes it even nicer. But in terms of what I see, and that's only what I have seen, but this maybe I have seen more than others because of my travel. No, but it's still very different from one country to the other, from one continent to the other. I also start to go more, for example, to Africa. Africa is very different also from a financial point of view, and the healthcare must be affordable and all these kind of things. But even Africa is not Africa. South Africa is not Ghana, is not Zimbabwe, is not Ghana. So they are all very, very, very different. Then I think we have also same for Asia. We talk about continents, but at the end, every single country is different, on all the continents. So there is some similarities, but there are also a lot of differences. I was lucky to go, for example, to Brazil last year. Brazil is still the fifth country in terms of geography size, and the eighth in terms of population. So, for example, in Brazil, the average distance to go to visit a GP is 75 kilometers. And to see a specialist is 152. And that's the average, because if you are in Sao Paulo, in the city, you are not in the Amazonia. So again, those kind of countries are then more open to adopt digital solutions, being telemedicine or whatever, because, they have a physical issue to go to the doctor. Then the other thing is I was lucky to go back to China in September, to Shanghai after the COVID, because I didn't go back since COVID. China, we have to be careful not to lose track also what is happening in China. Because of the geopolitical issues, we are isolating them. So what is happening? They develop their own solutions. So instead of being aware what's happening there, maybe, do some stuff together. We are now having a kind of bipolar world, or even maybe more than bipolar. If you look at politics, we have the Western world, and then we have Russia and China, and we are isolating them. But by isolating them, we force them to develop their own solution, which maybe we could also benefit from. So I think this is the kind of things, there's a lot happening. Of course, I'm a lot in the Middle East. So Middle East, for me, is, of course, mainly the UAE and Saudi. Of course, I also go to Qatar, but as just to say, in terms of size, you have the UAE, which is a very nice place, to do, the size is still bigger, than if I go to some smaller countries in other world. But they have the money, they invest, they want to change things, they are very innovative. They put a lot of focus, for example, on genomics, even holistic health, environment, because people may be surprised, how much focus the UAE is putting on impact and sustainability and environment, because everybody just see the skyscraper and they think, they are just crazy and they are overheating. But they have very nice projects. They have projects about replanting trees and stuff like that. Then Saudi is another topic. Saudi is bigger. Of course, you could say a UAE could be a pilot, and then the scale up is happening in a country like Saudi. So Saudi is amazingly changing the culture. People that don't go to Saudi, they have a wrong idea. They should go to see how it changed. I have some friends. You're in Canada, you mentioned. I have a friend from Saudi. She studied in Canada. And when she came back 2 or 3 years ago to Saudi, she said, Philippe, I didn't recognize my country. So much change is happening because they want to tackle, to be leaders, in all that space, and then want to attract expats. And to attract expats, you have to just change slightly your culture. You cannot have this negative feeling that people have about Saudi. To attract the people, you have to make it different, and they do it. They do amazing changes. I would not imagine how many years it would take in Europe to do this kind of cultural changes. So I think it's amazing what is happening there. Then you have Asia, they are countries in terms of healthcare. We even don't talk too much. For example, Thailand. Thailand is a very interesting country. It's not the richest country, but everybody has access to reimbursement and to healthcare there. So of course you can still improve the quality of the healthcare, but Thailand is not the worst in terms of quality of healthcare. So I'm just saying, things are happening very differently in the countries, and we are not always sharing it. On the other side, I said, countries are different, so you cannot always just copy paste, but we could learn a lot from many other countries.
We've covered some incredible ground today, but our conversation is far from over. In our next episode, we'll dive deeper and explore even more fascinating insights. Stay tuned for part 2 of our conversation on uncharted narratives. If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Certiat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Certiat.